Hello. I'd like to speak to you about immunizations. And what I want to cover in this section is not immunizations for the pediatric population, but immunizations for folks 19 years and up. Here is the recommended immunization schedule for adults. What I want to talk to you about now is not the pediatric series of shots, but immunizations from age 19 on. And this is actually taken from the CDC. I could show you the web address on the upper right-hand corner of the slide. And this is just a 4-page PDF file which tells you everything you could possibly want to know about adult immunizations. But I'm going to give you the highlights right now. The first type of shot on this list is the tetanus and diphtheria shot, or the TD. This is assuming the patient has had the primary series in the pediatric time frame. And what it recommends is that a patient have a booster shot of tetanus and diphtheria vaccine every 10 years. Okay? One of those booster shots throughout life, it is now recommended that it is a Tdap shot, which is tetanus, diphtheria, and acellular pertussis. And this will reinforce immunity for pertussis, which has been a recurrent problem in the adult population. The acellular pertussis vaccine is not for pregnant people, as it's a live vaccine. A new vaccine on the market is the human papillomavirus vaccine, which is indicated from ages 9 through 26. And this prevents infection with some of the strains of the human papillomavirus, which is a known precursor for cervical cancer. The measles, mumps, and rubella vaccine as an adult is most often reserved when there are outbreaks of the disease, especially in people that live in closed, tight communities such as college dorms, military, jails, those kind of places. And this shot is also needed for patients who work in healthcare facilities, for physicians and nurses who are taking care of other patients. Another way to prove that you have immunity to this illness is to have a simple blood test and do serology on these illnesses. If you already have natural immunity or immunity from a previous immunization, you do not need another MMR vaccine. Okay? Chickenpox or varicella can be given to adults. The vaccine can be given to adults. This is especially important for adult patients who have never had the chickenpox. Chickenpox can be much worse in adults than kids. Okay? It's a 2-shot series. Patients who work in healthcare facilities or going to school, to college, are often required to have proof of immunization or proof of previous immunity via a blood test. The influenza vaccine or flu shot is certainly indicated in all patients over the age of 50. Why? Because complications such as pneumonia and even death are more common in patients over 50 who get the influenza virus each year. Certainly patients who have any illness at all, including cardiovascular illness, including asthma and COPD, anyone with any chronic neurological disease. In fact, anyone who you consider not healthy at all should have their influenza shot each fall to prevent influenza. Influenza vaccine can also be given on request to patients under the age of 50. Anyone who doesn't want to have a week of fever, cough, malaise, and body aches each winter can certainly accept this vaccine. Healthcare workers should also be immunized, as they may pass the disease on to the next person as it is respiratory droplet spread. Okay? There is a second type of flu vaccine called FluMist, which is a live attenuated vaccine, and this is only for people between the ages of 5 and 49 and should not be given to healthcare workers, because a healthcare worker receiving this FluMist, this live attenuated vaccine, can spread this live attenuated influenza germ to their patients, and patients with bad immune systems can get sick and it will act as a pathogen and give them influenza. Pneumococcal vaccine is next on the list, and this vaccine is given to all patients over the age of 65. It's a one-time dose. It's also given to patients under the age of 65 who don't have a spleen, who are severely immunocompromised, or have renal failure. Even patients on high-dose steroids under the age of 65 should have pneumococcal vaccine. Pneumococcal vaccine is only given a second time if the patient is under the age of 65 by the time they're due for their second dose. The doses are given 5 years apart. So, for example, if someone has renal failure at age 55, they would get 1 dose at age 55 and 1 dose at age 60. The hepatitis A and hepatitis B vaccines we discussed earlier during the travel medicine section, and those are given when you're going to endemic areas or going to be engaging in behavior that is risky for transmission. Okay? Hepatitis B is also indicated for those people who have renal dialysis. They're exposed to a lot of needles and blood products. It's also indicated for healthcare workers, as they are exposed to many blood products as well. The meningococcal vaccine for meningococcemia is indicated for college students and college-age people. It is indicated for people who are living in crowded conditions, again, such as college dormitories, military recruits. Meningococcal vaccine is indicated for young adults, especially those going on to college and living in college dormitories in crowded conditions. It is also needed for travel to Mecca during the Hajj. It comes in the form of a single shot and should be given to young adults. Now, the contraindications to these vaccines are relatively limited. We've talked about the acellular pertussis being not given to pregnant patients. The varicella vaccine and the measles and mumps vaccine should not be given to those who have damaged immune systems on high-dose corticosteroids, as well as the pregnant population. Also, the chickenpox vaccine should not be given to those with HIV infection. These are the red areas on this slide. That concludes our discussion of immunizations.